I have with me today Dr. Shaakira Haywood Stewart. She is a clinical psychologist practicing in New York, private practice. So thank you for joining me.
Thank you for having me.
Today we're talking about abnormal uterine bleeding. And I think that's a funny word because even if you're not having your periods, that's abnormal too.
Yeah.
And what's normal is not necessarily, what's normal for me may not be what's normal for you. So we're going to kind of dig into that a little bit. And you were sharing with me that you had some patients that experienced this and from a mental health perspective.
Absolutely.
So please tell me about that.
Yeah, so I'll have clients come in, and I care a lot about the whole body experience because it does impact our mental health. And so when some of these clients are coming in, they might say, two in particular that I'm thinking about, one mentioning, that she doesn't have a period very often.
Yeah.
And then the other saying that she's always bleeding. And some of those things to me signal that they need to go to the doctor. But also when you think about mental health, bleeding all month, like think about the hormones that are released or even just the lifestyle that you have to live, always carrying, some sanitary, napkins or pads and tampons with you. Dating could be, difficult. All those things impact your mental health. And so I think for me, it's super important to just look at all those things. But also I think from a doctor's standpoint, like why is that happening? And, how can that actually impact their life?
And I thought about also financial.
Yeah.
You have to buy pads and tampons all the time.
All the time.
And we don't do enough for our people who can't afford those products. So that's another whole topic because we're starting to collect just feminine products for people, for the homeless and for low income people who just need just everyday stuff. So if you're having abnormal bleeding on top of that, I mean, I just think it's totally just uncontrollable. So one thing that you asked was like, why is that happening?
Yeah.
So different ages, it happens for different reasons. And how do we define it? Well, again, the definition is different. If you're having no period, that's called amenorrhea. And the most common cause is pregnancy. But
I see that with clients that struggle with eating disorders, particularly anorexia.
Yes.
And so that's something that also triggers me in terms of my clinical work, asking about their cycle. Is it regular? Is it irregular?
Yes.
Especially when we're talking about eating disorders.
And so, I'm glad you said that is because it can be hormonal, right? So a lot of times women some college athletes, or not college, but athletes, runners, gymnasts, anorexia, when you are not eating properly, hormonally, it can throw your periods off. So that is something that we definitely check. Then you can have people who bleed too long, right? Sometimes their periods last 10 to 14 days. Sometimes people bleed every day. Sometimes people don't have a period for 3 months at a time, and then they bleed for 30 days. Wow. Yeah. So all of those things are combinations of abnormal uterine bleeding. And how we assess it is, one, we do a full history, which honestly is one of the most important things when we talk about abnormal uterine bleeding. I mean, I had a patient one time and she was like, I've been bleeding all this time. And I was like, okay, well, what medications are you on? Oh, I take the pill. I said, well, do you take it every day? No, I'm taking it every day. I said, well, how many days have you missed? Oh, I missed about 3 or 4, but I've been bleeding for 30 days. I was like, because you missed 3 or 4 pills. But had I not asked that, I would have never known that.
Never known.
So the most important, well, not the most, but one of the most important things is getting the history, as you know. So I'm asking, what medications are you on? I'm asking, are there any trauma? Do you have a history of fibroids? I think one time you and I talked about fibroids before. That can cause abnormal bleeding.
Yes.
I'm asking, do you have a history of bleeding? Like you said, I'm asking, are your periods typically normal and then it stopped being normal? Did you ever have normal periods before? How old were you when you started your period? All of those things are important. Also, family history is important, right? My mom has fibroids. I don't know if I do, but this is something that I'm dealing with. So when I start the evaluation, we start with the history. We also do the physical. Sometimes I can feel masses. Sometimes, and depending on the age, if they're an older woman, sometimes they may have a polyp, which is just something sitting right there that likes to bleed, and they had no idea. Young people, sometimes they can have an infection in their cervix. Every time they have sex, they may bleed a little. And that's the thing too. I have to try to figure out, is it postcoital bleeding, which is right after sex? Is it no bleeding? Is it, again, like I said, you miss periods and then you have them? So all of that is important. And for mental health, I could only imagine how, I mean, they say it to me and then I'm like referring them to you.
And they're bringing it to me and I'm referring them to you. Because it's just all so connected.
It's all so connected. And I think one take-home message I would love our audience to know is that when we are taking care of patients, we're taking care of full body. So I can't ignore when a patient says, you know what, this bleeding is driving me crazy. And people use the word crazy loosely, but I don't ignore it. I'm like, well, tell me how that's making you feel. And by the way, can you go see my girl? Because she can help you with that. I can help you with this, but she can help you with the mental piece. So when we're evaluating the patient, it's important to get blood work. Especially, I don't care how old you are. If you're menopausal and you've proven that you're menopausal, then I may not get a pregnancy test, but I may slide it in if she's like, oh, well, I mean, you know, I have sex sometimes. I don't care how long you've been having sex, you're getting a pregnancy test if you have irregular periods or no periods. That's a mistake the ER makes all the time.
Because think if you were to prescribe a medication or have a procedure or something, it's like, wow. And people are like, oh, I've been 6 months pregnant. I had no idea.
I had no idea. You know, I've had patients
That's actually happened too. A few people I know.
Exactly. Like, I didn't, ma'am, you knew something. Okay. But I get that all the time. And I always play dumb. I'm like, well, ma'am, I just met you. I don't know what your story is. I'm going to get a pregnancy test. And I do say, you know, I don't want you to be upset when you get your results. Meaning, I don't want you to think I snuck a test on you. These are all the tests I get everybody. I'm not calling you out. I don't know what you're doing or not doing. I'm not calling you a liar. This is my panel. And I tell them that. I mean, I could put them in, but we get that. We get hormonal studies where we make sure that we look at your hormone levels in terms of one thing. I think you told me if your friend or something had a problem with her prolactin. So that can throw your periods off. You know, people who have PCOS. I don't know if you've ever heard of that.
I've got a client with PCOS.
You do?
I do.
Yes.
I do.
That can throw your periods off. Polycystic ovarian syndrome. And we change names all the time. So it could have been called polycystic ovarian disease. We get that because sometimes that throws your periods off. It is a hormonal issue that also can be weight-based. As well.
And does that involve like the endocrine system?
It does. It does.
Like
Yes.
Which again is like food and can be like controlled with like a lot of different things.
And so we get that diagnosis maybe before the endocrinologist or their PCP because they'll come to me and say, I haven't had a period in about 4 to 5 months. And I'm like, okay, well, in my mind, I'm thinking this is PCOS, right? And so I get certain lab work for that. If you're menopausal, you may get a different workup. If you say, I haven't had a period in 2 years, and now all of a sudden I'm bleeding, that's a different thought process too.
Maybe at the fibroids.
Could be fibroids, but typically fibroids shouldn't be bleeding when you're menopausal, but it could be cancer. The most common cause of postmenopausal bleeding is what we call atrophy. So the lining inside of the uterus just starts to kind of break down because we're getting older, and it's okay.
Makes sense.
It's okay.
We don't need it no more.
We don't need it. It's not really functioning for that purpose. And sometimes you can have a little bit of bleeding. So that's the most common, but the most worrisome is if it's cancer. So they get a different workup. But what my take home today is abnormal bleeding is not normal. So if you are noticing something, come in and see me. I want to make sure that you're getting the care that you need and that it's just not okay. Some people say, oh, I've been spotting or I'm doing this and that. And again, if you're bouncing it off yourself, then that must be normal for you. But that's not normal. You understand what I'm saying?
Absolutely.
So, and then I refer them to you if they're having an issue with that.
Yes. No, and I love that you said that abnormal is not normal because that's something that I often check in with and definitely, send your way because it could be a lot of different things.
It could be a lot of different
early
things.
detection stuff, it's going to be really important.
It's important. And a last thing that people always ask is, do I need a sonogram or a pelvic ultrasound? And my take-home answer is sometimes you do and sometimes you don't. So we leave that up to the physician once they're doing the evaluation if they feel like you need it.
Yeah.
I've had patients come in to me like, I want it, and I'm not going to give you a test that you don't need, that you have to pay for.
Yeah.
And I explain it to you.
Yeah.
I'm not just saying no. So thank you so much for
Thank you for
sharing
having
this time
me.
with me. And for my audience, I'm going to just say abnormal uterine bleeding is not normal. If you're experiencing that, please reach out to your doctor. Please think about some of the things that we talked about in terms of the evaluation, in terms of, and we didn't talk about treatment options, but that really determines or depends upon what the evaluation is. We didn't talk about treatment options, but that really depends on what your evaluation is. So once you get the evaluation, your doctor can determine that for you. Thank you again for joining us for Girl Talk with Dr. King. And thank you, Dr. Stewart.
Thank you.